Hello everyone, happy Wednesday and welcome to Real Time Roundup with Rachelle. I am, of course, your host, Rachelle Grossman, and we've got an exciting show packed with a little bit of everything for you this afternoon. From amazing medical breakthroughs to current events to great ways to network your business. So first up, we're going to talk with the co-founders of a local medical practice called CHARM. It's short for the Center for Healing and Regenerative Medicine. Now, when you hear the term regenerative medicine, you may think, ooh, that's a little bit like science fiction. Well, we're going to break it down for you today, and it's really giving hope to a lot of people who have lived with pain or injuries and really didn't have hope. We're going to talk more about that. We'll also speak with Dr. Renee Peach, who is the founder of Central Texas Foot Specialists. She's a local podiatrist, and when you think of podiatry, you think so much more than just bunions and ingrown toenails, right? With summer coming, you're definitely going to want to stay tuned because we're going to take care of your feet, and you'll love hearing about some of the new stuff they have coming out. A shoe out there for you ladies. It's called Bionic. You'll want to stay tuned as we talk about that. Speaking of summer coming, the Cedar Park Chamber of Commerce in the house today. We are previewing a big springtime event called Cedar Fest. We're in Texas, so we know you love barbecue. It is a barbecue cook-off and really a family fun celebration at Heritage Park. It's called Heritage Festival at Elizabeth Milbourne Park. And finally, we know the Chamber is a great way to network your business. But have you ever heard of a group called BNI? It's short for Business Networking International. And wrapping up our show is a friend of mine, Mandy Botts, who will tell us a little bit more about this wonderful Visitors Day event they have coming up on April 10th. But first off, we have Dr. David Harris and Michele Harris, the co-founders of CHARM. Great name. But an even better, I guess, acronym for what it stands for, the Center for Healing and Regenerative Medicine. Thanks for being here, guys.
Thank you.
Awesome. So Dr. Harris, you're a pioneer in really this field of regenerative medicine. I think a lot of people are hearing it more and more these days. If somebody has never heard of the term, in your words, describe what you do.
Well, regenerative medicine is a rapidly evolving field of medicine that basically takes the body's innate ability to heal and uses that to repair itself.
Sure.
So if you have joint pain, shoulder pain, knee pain, back pain, neck pain, or really any structural problem with your body, anything that hurts that's in the musculoskeletal system, we basically treat that with growth factors that we get from the body itself and use those to repair the damaged areas so that you don't have to do surgery and you can get back to playing sports and going back to your normal life activities without pain.
So really a non-surgical option to getting the body to heal itself.
Absolutely.
Sometimes surgery is required for certain conditions, of course.
There are a role for it, but over time we're showing that more and more things that we used to think needed surgery really don't need surgery anymore.
Yeah, and I'm a big proponent for if you don't have to like cut in and change it, let's try something first, right?
Absolutely.
So when we think of regenerative medicine, a term that a lot of people hear is something called prolotherapy. And folks, if you've ever heard this or maybe heard of stem cells or PRP, Dr. Harris is going to break down what each one of these, are they treatments or techniques, are and how they heal the body. So what would you say then is prolotherapy, Dr. Harris?
Prolotherapy is really the philosophy or the technique where you stimulate repair of those structures, say the ligaments of your knee or the rotator cuff tendons of your shoulder. With a needle, you inject them and you inject growth factors into those areas.
Okay.
The growth factors are several different ideas. One of them might be platelet-rich plasma, which is a solution that we get out of the patient's bloodstream, draw their blood and use the platelets to stimulate repair, because platelets are full of all kinds of different growth factors. When you inject them, they turn on the cells so the body will heal those tears for you.
So using your own body and your own body's fluids or growth factors from their blood to heal itself.
That's right.
Okay.
And then the stem cell idea, we've also learned that if you take concentrated bone marrow, you take bone marrow out of the hip area, and you can use the stem cells and the other growth factors that are in the bone marrow and inject them in the same way that you would inject platelet-rich plasma, and that's an even more powerful additive to the mixture to kind of get that soup in the area to get the tissues turned on to heal.
It's really an amazing concept, and I know you've been doing this safe to say decades now.
Right. I started in the mid-90s. About 1995 is when I started doing this type of work. And as the decades have gone on, we've got more and more recipes to work with. I started using platelet-rich plasma about 12 years ago and stem cells about 10 years ago. So we have a lot of experience in how to use those techniques, where to put them, a lot of the machines that you need like X-ray or ultrasound to guide the needles and to get the solutions into the right areas to stimulate that healing. Yes.
Yeah. So safe to say back in the 90s, did people think what you were doing was, maybe some fringe, what is this? And now, fast forward 30 years, we're hearing a lot of different, it's popping up all over the place, really.
Right. At the beginning, back in the mid-90s, I was one of the only people in this part of the United States who was doing this type of work. And it was very rare, and many people thought of it as witchcraft and voodoo.
Sure.
I mean, they thought we were doing crazy things. But now it's become pretty routine, and really every athlete on the field that you hear about who gets an injury now is not doing surgery. If they can at all avoid surgery, they're doing growth factors. Because our work, you do the injections, you treat the structure, they're sore for a few days, and they're back to playing and practicing and continuing their sports all that time. There's no downtime.
And not having all that downtime, yeah.
Yeah, you don't have to spend a lot of time in a brace, and you don't have to stay away from playing tennis for 3 months to get over your shoulder treatment. You're back on the court within days of us treating you.
I love it. And Michelle, what I think is really cool about Charm too is you have this whole medical component and side to the practice, but you come in with the physical therapy side of things. And when the two are married together, it really helps people, not only professional athletes, but everyone from, age 6 to 90. Mm-hmm. You work together to speed along that recovery process. You're a pioneer as well in your field. So it's something called Neurac. And I'll let you say the big long word so I don't butcher it. What do you do?
Well, it's more of an acronym.
Yeah.
Neurac stands for neuromuscular activation, and that's where the name comes from. But in essence, what it does is it gives you the ability to offload the body and work in a closed kinetic chain. And so think of doing a squat. You're in a closed chain. All of your muscles have to be working together. All of your stabilizers have to be working together. But what happens many times after injury, and certainly when pain continues, is we start using other muscles.
You compensate.
You compensate,
yes.
Yeah. And as we compensate, and as that builds as we get older, or as we try to keep doing our sport in compensation, then your joints wear out. Things start to really cause problems. And a lot of what Dr. Dave here does with the needles is to stabilize that connective tissue of that joint, but that doesn't change necessarily the neuromuscular control around that joint. And so we use the technique called the Neurac, using Redcord, to get all of the kinetic chains moving the right way again.
And when you put the two things together, really healing is sped up.
Yeah. I always like to look at it as, a wheel.
Okay.
When you tighten a hub on a wheel, like you would maybe stabilize a joint with what regenerative medicine does.
Sure.
You still don't have a wheel that runs and rolls straight unless you true those spokes. And so I look at what we do as truing the spokes, making sure all of the control around that hub works properly. And the other way around is true the same way. As that physical therapists, we can do a lot with physical therapy, but if you have an unstable hub, all the truing of spokes in the world is not going to let that wheel run straight.
Fix your problem or alleviate the pain.
Yeah. So the combination is why we developed Charm to begin with.
It's really cool. We actually have a video, folks, that we have produced that we want you to see because Michelle mentioned something called these red cords or red cord therapy. And this video, I think, really kind of explains what it does. And you get to see for yourself firsthand what these red cords look like. So let's go ahead and show folks the video real quick. Futuristic red-corded suspension contraption, or perhaps a little like something from a Mission Impossible movie.
You doing all right? Mm-hmm. Any pain in the elbow?
No.
Shoulders? Neck?
No.
Extensively trained physical therapist Michele Harris is working her patient through a series of ropes, slings, and specific moves designed to restore function. The red suspension cords eliminate the patient's body weight while performing closed chain exercises, helping this young athlete get back onto the playing field faster and pain-free.
That's it. It gives us the ability to offload the body so we can make it a pain-free situation. Because whenever there's pain, there's always altered neuromuscular control. And so with the Neurac, we get the ability to offload the body so we can do pain-free movement patterns.
It helps because people tend to change their muscle movements after an injury to avoid feeling pain. But these altered patterns can lead to bigger problems, other muscles compensating for the strained ones, and the brain deactivating or shutting off key muscles needed for proper stabilization.
It really is a very unique therapy in that we can quiet those that are compensating and doing the wrong job and get the ones that are supposed to be stabilizing and moving on again.
Michele became interested in this therapy option after realizing something was missing.
It takes the concept of strengthening a muscle completely to a different level. So this is not about reps and sets and strengthening a muscle over weeks. This is about turning muscles back on.
In fact, many people like Julian find they recover faster. In his case, he hurt his elbow, but through the Neurac system, Michele was able to identify additional weak areas to prevent further injury. Pretty cool, right, folks? So you can see how those red cords are actually kind of lifting the body up, allowing, I guess, would it be the stabilizer muscles or all of your other muscles to work correctly?
Yeah, the offloading is just to actually facilitate the right muscles to work. The cool thing after that is you can challenge the body immediately to a higher level of load. And so, as the video said, you're not strengthening muscles, you're turning them back on. And in one session, you can take a very compensated pattern, and because you can offload it and get the right pattern going, then challenge the body more and more, you can change things over just a couple visits.
So cool. And you're one of the only practices here. There's not very many of you offering this type of therapy.
Right now there's not. Yeah. It was developed over in Norway. It came to the United States in about 2007. I've been shocked that it hasn't taken off faster than it has. It will. Yeah. It's a fabulous therapy. But I think the combination of how we work the regenerative medicine together with this form of neuromuscular activation and re-education is really the key.
Sure. You are seeing more and more places all across the U.S. talk about it and really offer these types of therapies as well. Dr. Harris, what is your kind of opinion on that, and really what makes you unique and special?
Well, I think the number one thing that makes our clinic special is just the number of years that we've been doing this type of work. I mean, I've treated many thousands of people now over 23 years now using these techniques. And then Michele, as a physical therapist, has been working for many years. I won't say how many, but many years as well. And so we both have tons of experience. And then we have a whole team of excellent physicians and physical therapists all working together to get those goals met and to help as many people as we can help while we're here.
That's awesome. You have an in-house lab as well. So when it comes to getting the platelets from folks, you're actually doing that spinning technique.
That's right.
Right at CHOM.
Yeah, we do the techniques. The lab processing allows us to get much higher yields, much higher amounts of growth factors from the blood and from the bone marrow than more tabletop techniques that some doctors use. So the lab allows us to get a lot more precision, to do a lot more measurements, so we get the right growth factors that we use, and that gives us a lot more power per treatment. So we can get a lot more done with those techniques and also guide them precisely with the machines, with the x-ray and the ultrasound to make sure that the targets that we're trying to treat get well treated.
What are some of your success stories? What are some of the cases of folks that really who are hopeless? Maybe they're just living with chronic pain. I can't imagine what that's got to be like to live with that type of a chronic pain day in and day out, and then through treatment to kind of get back to life again.
Oh, sure. I mean, we have many patients that had suffered for 10 to 20 years before coming to us that we've been able to improve. So it's not something where you have to just have a fresh injury that we treat. We can treat people with many years of problems. We've had patients where they've been massive tears of the ligaments or massive tears of the anterior cruciate ligament inside the knee, large tears of the rotator cuff in the shoulder, things that many years ago, everybody would have assumed you needed surgery for, and you just don't need surgery for most of those things. The growth factors in the right places, done several times, will usually stimulate growth and repair of those to the point that the tendons and the ligaments can repair, and you actually get a permanent new structural weld, so to speak, of the damaged area.
And is it like a bone? So, you know, if you break a bone, there's that little bump on it, and the bone actually heals itself stronger than it was initially. Is that a similar type of response?
Frequently. And in fact, I tore my knee several years ago, and I had about a 70% tear of my medial collateral ligament, which is the ligament on the inside of the knee here. On my MRI scan, after we did a series of treatments, my collateral ligament is now twice the size of normal.
Really?
So it went from being almost completely torn and ripped apart to being double the size of normal now. It's much stronger now and much more stable.
Really cool.
And that's a common experience, that MRI scans over time will show that the connective tissues are tougher, stronger, thicker, more durable, the joints are stable, the pain goes away, the swelling goes away, the clicking and the popping goes away, and all that's permanent.
Wow, I got clicking knees myself here, so I need to come see you again, Dr.
Yes.
Awesome. How do folks find you guys? So if somebody is in pain and thought to themselves, you know, I maybe should get a little consult, what's the best way to find you?
Yeah, we have a website, probably the best way to find us, and on the website is a huge amount of information as well. I think that sometimes we look at a certain injury as being, I need something for that, but we need to remember the body works as a whole, and a lot of times an injury to the knee can find itself as hip and back pain in just a couple months as well. And so trying not to chase that pain, but go someplace that really has a big picture view, a holistic view of how to treat the body as a whole. And it's not just, fixing one joint and walking out the door. But yeah, our website does, I think, a good job at finding, explaining how the body works as a whole and our different services.
You're pretty cool people too. Yeah,
Yes.
They're fun to be around. Dr. Harris is a musician as well.
Yes.
So I've yet to see you play, but one day.
Well, we play at the Oasis. We got about 6 gigs later this year, so come on out there and see us there.
Oh, I might have to have you back on for that.
Yeah,
That's fantastic.
the band is called Natural Causes. So
Natural Causes.
When you see them over at the Oasis or some other clubs here in town, come by and see us.
All right, y'all got to text me when you're playing, because I'm coming, and I'll let everybody out there know as well. That's great. One last thing I want to say before we wrap up, anytime you're dealing with medical things, and I found this as part of my research, make sure your doctor has the right training and experience when you're doing something. Make sure your doctor has the right access to the technologies. And the thing that I thought was interesting too, it says make sure you get the right physical therapy and follow-up care. Right. And here you guys are working together and have done it for decades doing just that.
Exactly.
Thank you.
Yeah, really cool. It's called CHARM, the Center for Healing and Regenerative Medicine. We have their phone number there, 512-614-3300. And there is the web address, charmaustin.com. Michelle and Dr. Harris, thanks so much for being on today.
Thank you very much. Appreciate it.
So great to see you guys. All right, we're going to take a quick break. And when we come back, we'll have Dr. Renee Peach with Central Texas Foot Specialist. Stay tuned.